Hi, this is Ian Wright, and I often asked, what is osteopathy? What is it actually we're doing here? And so I just thought I'd start a little quick, a quick sort of answering that question, really, first of all. And I'll just do it about different subjects. Like today, for example, I think I'll talk about newborn baby checks and osteopathic newborn baby checks. And there's probably about 100 of these I could do, and we'll just do ones that people ask questions about. So, first of all, who am I? My name's Ian Wright, and I've been teaching cranial and paediatric osteopathy for, over 25 years internationally. We have the diploma in paediatrics in Ireland. At the moment, I'm involved in postgraduate paediatrics pathway in Italy, and just about to become involved in one in Brazil, which unfortunately we're having to lecture by Zoom these days, but sounds like it's a wonderful project where they're treating children who can't afford treatment in Brazil, and they're needing some support. So, and I'm also doing a conference in a couple of weeks' time on treating management of post-viral patients, for example, COVID, which will be quite an interesting conference, I think. So, what is osteopathy is the question. Osteopathy was founded by Andrew Taylor Still, who was actually a doctor in the 1800s who had a fascination for hands-on healing techniques. And again, we're talking about the days before antibiotics, before most kind of medications that could really have some of the profound effects they have now. And he connected sort of medicine of the time with healing techniques, bone setting, etc., and created this sort of form of work where you're treating things by putting your hands on and releasing all sorts of issues. And he'd travel around and treat people with all sorts of infections, illnesses, disorders that they were suffering in Midwest America in those days. And from that was born an osteopathic school, a form of osteopathic medicine. So, for example, today in the USA, you have to be a doctor. It's a DO is a doctor in osteopathy, and they can do surgery, etc., etc. In Europe, an osteopath is a separate kind of degree. The key point is it's the view of it, the way of approaching people is holistic, meaning you look at how all these interrelating systems of the body affect each other. And this is a really different way of looking at medicine, and looking at how one part of the body affects the other, and looking at the body as a whole, or the person, their emotional, mental, spiritual, physical, physiological cells as one. And that's what's beautiful about the philosophy of osteopathy. So anyway, that's a quick thing. I'll develop that in the future. But why would we want to check newborn babies? I teach cranial and pediatrics. Cranial is more of a gentle, hands-on, which you treat strains in the head and the body, but very gently releasing blocks and areas which have become compromised. But the most exciting, interesting thing about it is to develop this idea. And when I'm teaching this, you're looking at this idea of developing an evaluation, a complex evaluation of a newborn baby, and finding problems, but ironing them out at the same time. So you're evaluating and treating as one, and it becomes part of this beautiful, intricate process. So why newborn babies? In a lot of my pediatrics courses and the cranial pediatrics course that I'm doing, a kind of online immersion course which has just come out, which is great. We have these checklists, and a newborn baby checklists really is about evaluating what is normal development in a baby, and you use observation, you use neurodevelopmental tests, and you evaluate the hips and the spine and the ribs and the cranium and all these different areas to find if there's any difficulties, any problems. Now, why would a baby have any difficulties or problems? because they're actually babies are incredibly able to adapt to life. But there are certain things that happen in pregnancy, illnesses, operations, accidents, or birth. Even a normal delivery, the baby goes through huge compressive rotational trauma of the head. That's even in a normal delivery. And where there are abnormal deliveries, where there's shock and there's trauma and there's difficult deliveries, it can leave a variety of issues in the baby which can cause problems. For example, a baby can have a lot of shock, first of all, and shock can leave them irritable, crying, prone to sleeplessness and all that agitation, that type of thing. Or more specifically, if there's certain areas the head can get squashed pre-birth, it can be compressed between the head and the neck in the birth process, and there are very important nerve supplies which can affect, for example, the gastrointestinal system, the stomach, the gastroesophageal valve, and cause reflux, colic, etc., or other nerves that can affect the nerve supply to the tongue and the pharynx in feeding difficulties. So we have another checklist, and a whole complex thing is trying to decipher if a baby has feeding difficulties, what the cause of that is. And anyway, I'll do that. I'll talk about that one another time, because that's a huge subject in itself. So this newborn baby checks, if I'm lecturing this subject, it will take, gosh, you could do a week on it. So I'm just going very, very superficially just to understand what we're actually doing here. So you can have a baby that's crying, unhappy, reflux, colicky, irritable, sleepless, or you can have much more subtle effects of a birth problem, which is to do with, say, a little bit of compression between the head and the neck. And this won't show up necessarily. They may hold their head slightly to one side, but it may show up a little bit when they develop their posture, when they start sitting, when they start actually standing. It can affect the spinal midline mechanics, and it is so easy to release this in a newborn baby. It takes no time, and it's so important for later. Or you can have slightly more complex issues. So, for example, where there is a little bit of shock and trauma that may have affected part of the nervous system. But again, babies are incredibly good at overcoming this. But some trauma in the nervous system won't show up until later on, as the long tracts of the brain myelinate, and little areas can become affected, and you can start to feel this. But the great thing about newborn baby checks is you can release the shock and trauma, so nothing can actually then this baby who possibly would have a certain tendency doesn't go on to have the tendency. So for me, it's absolutely important to, in an ideal world, you'd want to check all newborn babies, because you can iron out these little tiny creases, and so that they are expressing themselves perfectly. Now, most babies can overcome all of this themselves. They're incredibly good, even if they have shock and trauma and stuff like that in them. They can release them, but sometimes they just need a little bit of help. And that's really what we do. Even if a baby's had a C-section, a cesarean section, they can have a degree of shock, a degree of recall. This is an elective, or it can have an effect on the poor development of the gut biota in terms of lack of bacteria through the vagina, and the development of the normal gut flora, and can make them more prone to things like reflux and colic. And you can support these systems with that type of thing. Or a baby who's had an emergency C-section, there's normally a lot more trauma to evaluate and treat. So what we're doing is the beautiful thing about what we do is we evaluate, and we evaluate each system, from the head, the mechanics of the skull, the cranium, the head on neck mechanics, the shoulders, the ribs can often get strained in a pre-birth position, and the organs, the nervous system. We do neurodevelopmental checks. So you're checking the whole system and ironing out little things while they're there. Sometimes they're so subtle that you don't even talk about it with the parent. You just treat these little bits and pieces because it's so subtle, it doesn't matter. So I hope that kind of gives you an insight into why we're doing this. It's really just ironing out creases, finding them, ironing them out, and allowing this unfolding of these beautiful babies in their most natural way, without any of the constraints that have happened in in terms of pregnancy, birth, etc., etc. But that, as a kind of an idea, is taken through treating everybody. What we're doing is we're trying to return each person back to their perfect normal, and it is a perfect normal, their perfect kind of blueprint. And illnesses, operations, accidents, trauma of any kind, physical, emotional, infection, etc., etc., has an effect, blocks things up. So we unravel it, simple, and as much as we can, and support the true manifestation of health. And that's really what osteopathy is about. I will come back next time and talk a little bit more in detail about my kind of newborn baby checks for feeding issues in babies, because that's a huge subject. And this is really, I mean, this isn't so much for practitioners, this is more for parents, actually, just to understand a little bit of what we're doing and almost the importance of it. Anyway, I wish you well.